Good afternoon and welcome to this special edition of Fight Back. This is the 2018 election healthcare debate. I'm Libby Znaimer. In survey after survey, most voters tell us that healthcare is their major issue. But so far, this campaign has been all about the horse race. The ballot question seems to be Kathleen Wynne. And if not Kathleen Wynne, will it be Doug Ford or Andrea Horwath? So this is an opportunity to get away from the personalities and to focus on the most important thing in life, your health, and how it will be affected by your vote. Joining us is France Gélinas, NDP health critic since 2016, and the candidate in Nickel Belt. For the PCs, we have Christine Elliott, former Progressive Conservative health care critic and patient ombudsman of Ontario. She is running in Newmarket, Aurora. The Liberals chose not to participate despite our numerous attempts to bring them to the table. Quite frankly, barring a miracle, they are unlikely to remain in power. So what we will be hearing over the next hour and a half will certainly be on the agenda for the next 4 years. This event is staged by CARP in partnership with 15 organizations representing doctors, nurses, and patients. I won't name them so I don't get in trouble. Before we go to opening statements, let's have a coin toss to determine the speaking order. Daria. Okay. Christine, you'll be heads. Okay. France. You have 1 minute for your opening statements, 1 minute each, and then 3 minutes to debate each other. France, go ahead. Let's start the clock.
Good afternoon, everyone. Thank you so much for joining us. I'm happy to see that there's many familiar faces in the crowd. As it was mentioned, I'm the NDP candidate in the riding of Nickel Belt, which is in Northern Ontario, and I have been the health critic for my party since 2007 when I was first elected. Medicare is a program that defines us. It is a program that says to all of us, care will be based on needs, not on ability to pay. And whether you're Canadian, Ontarian, this is something that we all believe in. The platform that we are bringing forward is a platform that reinforces those beliefs that health is a right and access to healthcare is something that should be available to all of us, not based on our ability to pay, but based on our needs. I'm looking forward to your question, and I'm happy to be here with you.
Okay. You did that with 2 seconds to spare. And now, Christine, your minute begins now.
Well, thank you very, very much, Libby, for hosting this healthcare debate, and to CARP and for all of the healthcare organizations that were involved in organizing it as well. Healthcare is a really important issue to people. It always has been in every election, but I've never seen so many people talk about it and so passionately as they have during the course of this election. So we have focused on that in the Progressive Conservative Party. We have indicated, Doug Ford, as our leader, has said that he wants to end hallway medicine. And I have heard that as I've traveled across the province in my own riding of Newmarket, Aurora. It's an issue that people should not be dealt with when they go to the hospital. They don't expect to be cared for in hallways or in storage closets. That's happening far too often. So what we really need to do is concentrate on solving that problem. One part is creating more long-term care beds, because 25% of the beds in any hospital at any time are occupied by people that don't need to be there. So we need to work with hospitals and home care organizations to bolster our home care facilities and build more long-term care facilities.
Okay, you almost went over there. And now to the questions. You will each have a minute to answer and up to 3 minutes to debate each other. Feel free to be brief. And I think, Christine, you stole a bit of my thunder, because 2 words were at the crux of the healthcare debate since the beginning of the year. Hallway medicine. And it wasn't just hallways. Doctors and nurses were and are still using waiting rooms and even closets to treat the overflow of patients in our hospitals. So, what will your party do to fix the crisis? Christine, you can start this time.
Well, thank you. One of the major ways we need to deal with that, since, as I said before, about 25% of the patients in any hospital at any time are patients that need to either go home to have more home care supports or need to go into long-term care home. So you can eliminate hallway medicine if you deal with that properly so that people can get to the most convenient place, preferably home. That's where everybody wants to go. They get the best care there. They want to live at home, and it's also the most inexpensive for our healthcare system. Doctors and nurses are feeling increasingly frustrated having to treat patients in inappropriate locations like closets, storage rooms, hallways. That doesn't give people the dignity that they deserve or the proper health care that they require. So we need to work on that. That will open up the flow to the hospital so that those beds are available for people when they come into hospital so they don't have to be treated in hallways.
France?
Well, it was over 2 years ago that we started to get stories of people being admitted into a hospital in all sorts of unconventional spaces. So we started filing freedom of access of information, and we started to gain the data. And I've been in healthcare for 25 years. I had never seen anything like this. I can speak about Olive, a woman 84 years old. She spent 3 weeks in a TV lounge with 5 other people, with no bathroom, using a commode where everybody can hear you go to the bathroom. It was degrading. It was not conducive to care. It was awful. So we started bringing that forward, and basically you can find the decision. When the Liberals decided to give 0 budget increase to our hospital 6 years ago, the first year our hospital coped, kind of. Year 2, 3, 4 were a disaster, 5 and 6 were no better. We need to invest into our hospital so that they are there for us, so that they can bring the staff, so that they can open up new beds.
Okay, now you have 3 minutes to debate each other. It sounds to me like you're focusing on long-term care, you're focusing on more money for the hospital, so please.
I'm not opposed to bringing more long-term care. I agree that we have over 17% of all of our hospital beds are taken up by people who would be better cared someplace else. It is the entire system. It is the responsibility of the Ministry of Health is to be the steward of our system, to plan it so that it meets our needs. They have been failing at that drastically. So our hospital being the net of last resort, they catch us all when other parts of the systems fail. Right now, our long-term care system is failing us. We have 78,000 beds, 34,000 people waiting. Our home care system is no better. We have over 4,000 people waiting for the care they need at home. All of this has to be fixed. But in the short term, it is our hospital who will catch us all, and we don't want anybody to fail.
Well, there are over 30,000 people waiting for long-term care beds, and those are mostly the people who are in hospital too, the alternate level of care patients. We need to have a plan for that. We have over 2.3 million people who are seniors in Ontario right now. By 2041, that number is going to go up to 4.5 million. So as bad as it is now, it's going to get worse. And I don't see any indication of a short-term or a long-term care plan from the Liberals as to how we're going to deal with that. No plan as to how we're going to deal with the increased numbers of people with dementia, Alzheimer's, and others dementias. It's just a bunch of ad hoc little changes that they keep making with no bigger plan in mind. And when you're managing something like Ontario's healthcare system, you need to have a plan because there's so many challenges there. But what we do see is an increase in bureaucracy. When the Liberals took power in 2003, there were 5 assistant deputy ministers in health. There are 21 now. And I would ask the people in this room and the people of Ontario, is your healthcare any better? I don't think anybody would say yes.
I agree with the ballooning of our bureaucracy, but at the same time, I mean, when I hear Doug Ford say that he will find 4% of efficiencies, I have seen what efficiencies look like. We ask our hospital to be efficient. We ask them to go on 0 base budget increase, and we see the long wait in our emergency department. We see the people lining up in the corridor. I don't want any more of this. 4% is $6 billion. When healthcare takes half of the expenditure budget for services, services, then that means billions of dollars coming out of our healthcare system. We have to undo the damage that has been done by the Liberal and the Conservative. We need to invest, not take away.
But we also know, international studies have shown, that we are investing $61 billion a year in healthcare, but we're not getting good value for those healthcare dollars. So we really need to take a look across the entire system from the patient's perspective and see what do we really need to do to offer excellent patient care.
Okay. Once again, you've anticipated my next question, and it is because the whole thing is connected. And that's the whole question of long-term care, alternative level of care, which is bureaucracies for people who should be leaving the hospital, but they don't have anywhere to go. They don't have anywhere to go because there are not enough long-term care beds. Now, the Liberals have promised another 5,000. The Conservatives have promised a much, much larger number. Some of the people that I talk to in the system say the Conservatives, what is it, 30,000 beds you're promising over 10 years? That's unrealistic because there just isn't an infrastructure in place to make that happen. So we'll start with you on that.
Well, we have indicated in our platform that we would build 15,000 long-term care beds in 5 years, and for a total of 30,000 over 10 years, so another 15,000 within the next time period. So we know that we don't need to build entirely new ones. Some of what we're planning is to refurbish some of the existing homes, because we know in some communities there may be an A-level home that everybody wants to go to, and there may be a B or a C-level home that people don't want to go to because it's not in very good shape. So we need to make sure that we put the dollars into refurbishing those homes to make sure that we can cover all the people that we need. But we also know we've got this big baby boom generation coming forward. And so we have to prepare for that, but then we have to take a look at what's going to happen after that. And we need to make sure that we invest in home care as well, because ideally we'd like to have people at home for as long as possible. And we're doing some amazing things in home care right now, like telehome care, for example, that perhaps I can speak about in the next section.
Well, we know that we need a long-term care system. We knew when the baby boomers were born that 70 years later, they were going to be 70 years old. We've had all that time to plan, and yet nobody has done any of that planning. It's like on the eve of an election, all of a sudden people woke up and said, oh, we need new long-term care bed. Really? Where have you been? The number is not the only issues with long-term care. If you look at what's going on within our long-term care homes, the level of care has been going up and up and up. 90% of them have cognitive impairments. 2/3 have a diagnostic of dementia. 1/3 of them severe dementia. You're looking at bowel and bladder incontinence, all of this. Very high level of needs, very few staff. We need 4 hours of hands-on care to make sure that the people that do go into a long-term care home get the respect they deserve and the care that they need.
You can debate each other now.
Well, I don't think there's any dissent about the fact that people do need more hours of care. I certainly heard about that during my time as patient ombudsman. I also heard from a lot of family members who've told me that they were afraid to make any comments about the care their loved one was receiving because they felt that that would be turned against their loved one and that they would receive worse care. So we need to take that fear away. We need to create an open and transparent system where people feel that they can make comments for improvement. Every organization can make improvements, and we need to take that away so that we can truly build an excellent system for the frail elderly seniors who are so vulnerable.
We have an opportunity right now. There is an inquiry going on because of something awful that has happened in some long-term care. Why not expand this inquiry so that we can do a find and fix? As you find systemic issue, let's fix them. And one of them that needs to be fixed right here, right now, is couple reunification. I have 9 couples, been married for 50, 60, 70 years together. They still love one another. They're in 2 different nursing home, and I cannot bring them back together because we have a system that don't care. This is so wrong. This could be fixed. This is something that Andrea Horvath and the NDP, we will fix this the day where we make it into power. We will expand the inquiry so that we have an opportunity to find and fix, and we will build new beds. I agree that some of the 34,000 people waiting for long-term care, if our home care system had been more robust, had been better, they would not need to be on that list. Remember I said the planning of the whole system needs to be fixed? It does, and right now it is failing more people than it is helping.
And I think that's the issue with healthcare. As soon as you make a change in any one section, you have to anticipate there's going to be 2 or 3 other things that are going to happen down the line that are going to be negative effects. We don't see the Liberals really anticipating that. They make decisions without really thinking it through, and as a result, we end up in the situation that we're in. But nobody can excuse, as France says, the lack of planning when you know the baby boom generation is a huge group of people. They're getting to that age, and yet there seems to be no concern directed at that, certainly by the Liberals. That's something that we as progressive Conservatives would deal with. I agree that I think that scope of the investigation does need to be expanded to take a look at all of the issues that are in long-term care that need to be fixed.
Okay, again, you've anticipated the next question, and again, it's because healthcare is so connected, and that is the lack of home care. Ontarians want to continue to live at home. They can't get enough support to do so. And many people, it's interesting to me, they don't even get the hours they're allotted because overbooked personal support workers simply, they just don't stay for the full time designated for their visits. I don't even understand how that works. So if elected, how will you address these problems? France, your minute starts now.
Okay. Well, I can tell you that a lot of people phone my office every Monday morning when we come into work. We play the answering machine, and I guarantee you that I will have complaint against healthcare, against home care. Somebody sitting at home. She was supposed to go to a baptism of her grandchild. The person who was supposed to transfer her into her wheelchair never showed up. Our home care system is broken. It fails more people than it helps. It has to be fixed. When the Mike Harris government was there, they put limit on the amount of care that people can receive. It doesn't matter that your needs are that big, you will get that much care. Where does that come from? No other sector of our healthcare system only gives you a set amount of care no matter your needs. This has to be fixed. An NDP government would do away with those limits. Make sure that you get the care that you need so that you can stay at home, and make sure that the people who work in healthcare are respected so that they show up for their work.
Christine, your minute starts now.
Well, I am a strong advocate in favor of home care because that's where people want to go. They want to go home from hospital. They want to be with their family and their loved ones, to have the food that they like to have, to continue their traditions and so on. From a government's perspective, of course, it's advantageous because it's the least expensive type of care too. So I think we need to put more money into home care to allow people to be able to go home. But we find often that it's not connected. Sometimes people end up back in hospital before they're even connected with home care. But there's amazing things that can be done. I had a visit with a woman in Sudbury several months ago who was receiving telehome care. She'd been in hospital for several months, and she had a chronic disease that she went home and she got hooked up with telehome care. Every morning she signed in and she took her weight, she took her blood pressure and so on, and she was able to hear back from the nurse about whether everything was all right, whether she needed to adjust her medications, or whether she needed to go back to see her doctor. I can't even tell you the peace of mind that gave her to be in her own home.
Okay, right on time. The debate portion for this question is now starting, and I want to remind you, the people here are using this debate to make up their minds, so please take each other on. You're debating each other now.
Yeah.
You're telling us why your plan is better than your plan.
Well, I will start by saying that we have a plan. You can go onto Google right now, Ontario NDP platform, and you will see our plan. You will see that we have $300 million put in our plans to provide more home care, to fix our home care. This is something that your party cannot say. We have not seen the platform. You can say that you want to invest, but where is this money coming from? All we know is that there's 4% of efficiencies to be found, and that means $6 billion that won't be there no more to do home care, to do long-term care, to do primary care. This is worrisome to me. An NDP platform, we have set out our priority. Home care is part of our priority. There is money attached to it. We're really straightforward as to how we will use this money to improve the care of the people who need it. We will do away with the 4,000 people waiting for a PSW to come and see them. We will fix the home care system. You can read it. You can hold us accountable. None of that exists for your party.
Well, we know we're in a deep financial hole in Ontario. I think everybody knows that, thanks to the Liberals promising free things to everybody that our children are going to have to pay for. So we have to focus on priorities. And a priority for us is what we've heard from the people of the province of Ontario, that we need more long-term care and we need more home care. We hear that from hospital administrators as well. They want to be able to provide quality care for everybody that comes there. Part of the solution to that is more long-term care beds and more home care. So we will be coming out with a fully costed platform, and rest assured that a PC government will not spend money that we don't have. We will focus on priorities, and a priority is enhanced home care for people, because we know that that's what people want, that's where they should be, and we can deal with it with increasingly complicated medical conditions.
Can you give us an idea of the scope of the investment you intend to do in home care or long-term care?
Long-term care, we've already indicated that we are going to be bringing forward 15,000 long-term care beds in 5 years, which we've got accommodated in our overall platform, as well as an additional 15,000 within the 10 years after that, for a total of 30,000 beds.
And how much money attached to that?
That is going to be coming out with our fully costed platform. We're not releasing individual amounts, but we will be releasing it so that people can see that we do have a platform that is within our means, that does deal with the priorities. We have talked about, as one of our 5 major planks, the fact that we are going to end hallway medicine. And the answer to hallway medicine is more long-term care, it's more home care, it's more operational money for hospitals, which is going to allow people to not wait in line for up to a year for things like hip and knee replacements.
But we don't know how much more money is coming, and we don't know where that money will come from.
It will be coming very shortly, so the people of Ontario can decide.
Okay, time's up. Next question. Each party recognizes that there's a crisis in mental health and addiction treatment. It's especially challenging to navigate given the lack of resources, supports, and the fragmentation of the health system. So, what is your party's plan to address this?
So this one, Christine and I were both on the Select Committee for Mental Health and Addiction. That was something that she had asked for and that the Legislative Assembly agreed to do. Our number one recommendation, we had 23 recommendations. Our number one recommendation was to give mental health and addiction a home, to make somebody responsible, that this will be their priority so that we can have transparency, we can have accountability, we can make sure it happens. An NDP government would put forward the Ministry of Mental Health and Addiction to give it a home, to make somebody responsible, to make sure that the best practice that exists becomes available to everyone that needs it in the province, and that we hold mental health just as important as physical health. We provide the care they need where people live. There are good services available to some people, depending who you are, where you live, and the age and the sex. That makes no sense. The service has to be there for all of us.
Well, I did have the honor of serving with France on the Select Committee on Mental Health and Addictions, and we made about 20 recommendations, I think, that we all agreed upon, and that isn't something that often happens at Queen's Park, but I think that was among the best work that I did during my time there. One of the things that we have talked about in our party is investing $1.9 billion in mental health and addictions programs, and that we will match the $1.9 billion that the federal government is committed. So it does need to be seen as something that is as important as physical health. We need to do a number of things there, from everything from employment to housing to services and so on. Some of that money we would use to build affordable housing, like we know that's a huge concern. Some would be used to enhance capacity, and the last part would be to create a Mental Health and Addictions Ontario, as we talked about, to be the one that is the collects the best information across the board and to make sure every part of Ontario has the same core basket of services for mental health and addictions.
Okay, I'm not sure we need a debate since you violently agree with each other on this, except I know that some of our stakeholders believe that mental health should not be, quote, siloed, that it should be integrated in the rest of the health system, and you were talking about a separate ministry. So perhaps if you can debate each other on that, just...
Well, sorry. I just would say that of the 20 recommendations that we made, the Liberal government only took up one of them, and that was on opioid addiction. So there's lots of other recommendations that all three parties have already agreed upon that could be implemented. But I think that one of the things that we need to move forward on is to break down some of those silos and to make sure that all ministries speak to each other. And I think that what the Liberals have done with having a committee that the deputy ministers come to and talk isn't strong enough. I think that we need to have a minister that's responsible. I'm not sure that I would recommend a separate minister of mental health, but we need to have probably the health minister be the lead, but all of the other ministries need to be involved too, because we've got to stop dealing with this in silos. It's housing, it's justice, it's ComSoc, it's post-secondary education. There's probably about 10 ministries that need to come together on a regular basis to create a holistic solution to this problem.
Well, there are 11 ministries right now that provide mental health and addiction services. What we have, it has been there for a long time. We have tried different tables to talk to one another. It doesn't work. We still have this patchwork of mental health that doesn't serve the needs of the people. A dedicated ministry would fix that. But one question I do have for Christine is that I'm strong in math. $1.9 billion over 10 years is $190 million a year. And $190 million a year, how many supported housing can you get? How many new service can you get? There is no intensive therapy north of Parry Sound. I live, like many Northerners, we live north of this. We have zero services available. Where is the money going to come from so that we have equitable access?
Well, you keep on building those services year after year, and you just don't stop, because we know that there isn't really a system for mental health and addictions in Ontario right now. It's just a section of disconnected groups that don't form that holistic group that you need in order to provide service. And I would totally agree with you. In the north, those services are largely lacking. I know there's some tele-mental health that goes on, but that doesn't really equate to sitting down with a professional and being able to speak about your issues. So there's a lot of work that needs to be done. And that's why I think Mental Health and Addictions Ontario could work like Cancer Care Ontario to be that organization that coordinates care in all of the communities across Ontario, concentrating, I think, at first in the north, because I would agree with you. The services are sadly lacking there, and people need help.
Okay, let's move on to the next question. Let's reset the clock. Give it another couple of seconds. So 10% of Ontarians do not have a family doctor, and that's well over 1 million people. In the north, those numbers are much worse. More than 16% of people don't have a primary healthcare provider. And according to the Commonwealth Fund, that even if you do have a family doctor, Canada ranks 10 out of 11 in terms of being able to get in to see that family doctor in a timely manner. So what are you going to do about it, Christine?
Well, it is a serious problem, and I witnessed it in one of my trips to the north not that long ago, where people told me that in order to get an appointment to see your family doctor, you had to call at a certain time. It was like noon on Wednesday that you had to call. And you'd call and call and call and call, and it was just like, your luck if they picked up the phone and you got to make an appointment. We should not be practicing healthcare in Ontario that way. Everybody deserves to have a family doctor, and we need to take a serious look at this. We've talked about this for many, many years. The reality is that a lot of medical graduates end up coming to the Toronto area and not staying in their home communities even. So I think we need to work first with the OMA, we need to work with the universities, perhaps have satellite medical schools, something to keep people in their own communities because they're more likely to stay there when they graduate. So I think we need to be creative with this. We need to take a look at how we can get family physicians into those parts of the province that are really in need.
You are absolutely right. There are close to 30,000 people in Sudbury-Nickel Belt that do not have a primary care provider. They don't have a family physicians. They don't have a nurse practitioners. There are models that exist that works good in the north, whether it's a community health center, a Aboriginal Health Access Center, a nurse practitioner-led clinic, or community family health teams. What that does in the north is that if you set one of those integrated primary care program, if somebody leaves, the nurse practitioner leaves, or the physician leaves, your charts stay there, your care stay there, the rest of the team still knows you, and there is somebody in charge of doing recruitment. So we have committed in our platform to building 35 new of those, and that certainly will help in northern and rural, and wherever we have people who don't have a primary care provider, physician or nurse practitioner, to make sure that they do, not only right now, but also into the future so that they stay attached to those clinics. Let's face it.
Okay, time's up. The debate portion is starting, and I have to say, this has been an issue ever since I can remember, decades. So please debate each other and just, it's one thing to say you're going to fix it. How are you going to fix it? Please.
Well, in many parts of the province too, people without a family physician end up going into walk-in clinics, which is not the kind of health care you want because it's somebody that sees you once, may not have your medical records. Your family doctor can sometimes be charged for that, which is also not good. We need to make sure that people can get the care that they need. And I would agree, in many cases, it might be a nurse practitioner, it might be someone else that people can see that's going to provide the health care that they need, but they still need to have a family physician. There's some things that even though nurse practitioners have expanded scope of practice, and I certainly support that, there are also situations where a family physician is needed. One of the things I think we also need to talk about is what happens in medical school, because there's a lot of young people that choose particular specialties that end up because they want to be a cardiologist, for example. We may already have too many cardiologists, so we need to make sure that we talk to them about what the scarcities are so that they can make good decisions. I know the medical students came to Queen's Park several times during the time that I was there, and I'm sure they're still doing it, that they want to get some direction about where the need is and what they should be going into. And I think that family practice sometimes is really low down in the line that they don't think about, but it is the entry into care for most people, and it's a really vital service that they perform. So we really need to take a look at what's going to get people in family practices and what supports do they need in order to stay there and to go to parts of the province that don't have enough family physicians.
The situation in Northern Ontario is sometimes really difficult and people don't have access, which means you have a diagnostic, you get sick, and there's nobody there to follow you. This has to change. Let's face it, the relationship between the Ontario Medical Association and the Liberal government was awful. The way that the Liberal government
Still is, as far as I can tell.
has treated our physician is just shameful. It should have never come to this. I can guarantee you that a NDP government will be a partner with physicians to make sure that we can move forward toward an agreement that makes sense for all, and especially for the patients who need the care that those people provide. In Northern Ontario, if you are the solo physician, you are on call 24/7. Everybody knows you. Everybody knows where you live. After a while, they all burnt out. You can't do this. You have to have a system in place that will back you up. You have to be able to count on the government who will be there to be your partner, to give you the care you need. The physician tried to transfer to Sudbury Regional Health Sciences North, the hospital in Sudbury, Sudbury, they won't accept them but because they're over full. That's no way to practice medicine.
Okay. Next question. Ontario patients need a lot of patience for many medically necessary procedures. According to the OMA, in 2016, it took up to 209 days to get a hip replacement, and that is up 48 days from the previous year. It takes an average of 54 days to get a CT scan in the province, and 15.4 weeks to get an appointment with a specialist. And by the way, for that metric, that's actually the shortest wait time in the country to see a specialist. It boggles the mind. So how will your party change that up? Let's start with Christine.
Sure. Well, the wait times for surgeries and treatments in Ontario are unacceptably long. In some cancer surgeries, the wait time for surgery can be up to 90 days. I mean, it's literally a matter of life and death. So we do need to do something about that. Part of the problem is, I guess, in part because of the government's fractured relationship with the OMA, and also because of the slowdown in funding for hospitals, is they don't have the operating room capacity. So there's a number of surgeons that are sitting around wanting to do more surgeries, but they don't have the opportunity to because the operating rooms aren't available for them. So we need to stop that. We need to make sure that the hospitals are funded in order to be able to perform these surgeries, because we have people that are waiting for up to a year for surgeries for hip and knee replacement. They're living in pain. They can't go to work. It's affecting productivity, not to mention what's going on in human life. So it's essential that this be dealt with, and there's a solution both in working with the OMA as their partners and in funding hospitals properly.
The wait lists are everywhere. I can quote from my riding. You want to go into, I only have 2 long-term care homes in my riding. For one of them, the wait list is 1,331 days. I'll do the math for you. That's 3 years, 7 months to get into a long-term care home. That makes no sense. Same thing, we have the hospital runs their MRI and CT scan 24/7, which means that you may very well get your appointment at 2:30 a.m. to go for a scan. They do it, but during those last years, the last 6 years of the Liberal government, where they did not invest into our hospital have a backlog of their equipment is coming to an end, it breaks often, it needs to be replaced. None of that money exists. We will invest into our hospital, 5.3% increase. We will make sure they have the money they need to be able to open up their operating room and their diagnostic imaging and everything else.
Okay, the debate portion. So again, I want you ladies to take each other on and tell us why you'll fix that better than the NDP.
Well, I think some of the issues really under the Liberals weren't really dealt with. For example, the idea of a mobile scanner that would have made sense in Sudbury that never actually happened because the Liberals blocked it. Why? When it could go on the road, it could be of so much use to so many people, it could reduce the wait times. There's some very sensible ideas out there that would bring relief to people, provide value for the equipment, and serve the public. So we've got to open up, we've got to consider all of these ideas, we've got to look at what's important from the perspective of the patient. And maybe that's because of my previous job as patient ombudsman, but we really do need to look at that. So some of the things that happen in hospitals, for example, when a patient walks in until the time they are ready to have surgery, they may have to go through 20 steps, go here, go there, sign this form, do that, when they don't really need to. If you take a look at what does it really matter to the patient to get them the care that they really need, you can cut a number of those steps out, not people out, you can cut a number of those steps out to be able to provide better patient care.
The wait times have increased exponentially. The number of hours that people wait in our emergency room are not in minutes and hours anymore. We count them in days, because you can spend over 1, 2, 3 days. There are kids that will spend 4 days in the emergency room before we can find a room for them. This is not acceptable, but it is a symptom. It is a symptom of, I would say, it started with the Conservative and continue right on with the Liberals, of not investing in our hospital. It has to be done. I know that it's not sexy to talk about this, but it needs to be done if we want our healthcare systems to be there for us. And when you look at our platform, it is costed. When we hear about the PC, we hear about we will do this, but we will also cut $6 billion from they will cut $6 billion from the provincial budget. The two don't add up. It's okay to have good intention, but you have to have a plan to make those good intentions become a reality. Otherwise, you have a credibility issue. And right now, the PC have a huge credibility issue when they say they intend to fix healthcare and cut $6 billion at the same time.
Not at all. We understand what the priorities are. We understand what the concerns are. We've talked about some of them today. We've talked about long-term care. We've talked about home care. We've talked about the need to make sure that hospitals can treat people in rooms and not in hallways.
And how much money are you attaching to that?
Reducing some of those wait times, but some of it is the way things are done and how we do it. And so things like mental health and addictions, there's multiple admissions into hospital for mental health and addictions because people don't have anywhere else to go. So if you make the investments in that, that'll cut down on some wait times.
So
if you make
how
the
much
investments in
saving
long-term
comes from
care,
our hospitals?
that will cut that down too. Hospitals need the supports. They need to have the investments to be able to offer timely care to people, because time is often a matter between life and death. And that's something we all take very seriously.
Okay, well, another topic that we've been alluding to, and that is rural areas and the north. And whenever you hear an average number for any healthcare service, you can be sure the situation is worse in the north. Underserviced rural communities want to attract healthcare providers who will practice and live there for the long term. So, France, this is like a lob for you, so go ahead and smash it.
There are, as I mentioned, models of care that works way better in Northern Ontario. The models of care that exist that work good: nurse practitioner-led clinic, community family health team, community health center, Aboriginal Health Access Center. Those are all interdisciplinary primary health care team that sets up, that are accountable to the people they serve, and that stays there no matter how many people come and go through the north, because we are sometimes able to recruit, but we're not able to retain. Your chart stays there. The people that you know care for you. Some of the team members are still there, and you have somebody responsible for recruiting. But it's also important to know that you will have your government's back, that when you call for a referral, you're not going to get, our hospital is so full we can't take your transfer. You will have to look after them, although they're not equipped at all to look after the type of patient that should have been referred to a tertiary center. There's lots that can be done. It has to be done.
Well, there's no question that northern and rural communities don't get the same quality of healthcare that happens often in southern Ontario, and that different models of care are required. I certainly agree with you on that. And then there's also the fly-in communities, some of the Indigenous communities where care is provided federally, of course, but you have to connect with provincial hospitals, and of course the ambulance services. So some of that is making sure that that care is better coordinated, because often people fall between the cracks. I heard a story on my last trip there, where a young child died on a reserve, a fly-in reserve, from strep throat, because they didn't have basic medications there. So we need to do a lot of work to make sure, with the federal government, to make sure that we close those gaps so these sorts of things don't happen. It's unthinkable that in Ontario something like that would happen. But we also need to take a look at how the care is being provided. Personal support workers, for example, have to drive vast distances to get from one job to the next, and they don't always get paid for all of their expenses. So at a point, it's almost not worth being in the business, because it's a money loser, not a money gainer.
Okay, again, you seem to agree, but what about incentives to, entice healthcare workers? Please debate each other on that note.
Well, I think we do need to offer some incentives for people and to have them stay for a period of time. But we also have to take a look at some of the conditions in some of the communities, particularly use the fly-in communities once again, where you can buy a couple of liters of pop for less money than you could buy probably a liter of orange juice or milk. So we have to look at improving the social determinants of health, better housing, better nutrition, and so on to build a healthier population. But we also need to take a look at how can we connect people better with healthcare. So some of it is telemedicine. I think it is being used more and more often, where a general practitioner in a small community can connect somebody to a specialist because it's the middle of winter and the nearest drive is 3.5 hours away going into Thunder Bay. From Dryden, for example, or Sioux Lookout. We need to make sure that people have the supports that they need in order to practice medicine there and so for them to feel that they can properly care for their patients. And I heard of many situations where people have appointments with specialists from some of these smaller communities and they actually don't go because they don't have the money, the Northern Travel Grant comes too late, so they end up just not getting care. And so we can't allow that to continue. Everybody in Ontario deserves to have excellent quality medical care.
I would tell you that this is why we are doubling the money that we are investing in First Nations health so that they get the care that they need, just like all of us, to make sure that when I say the government has to plan, we have to make sure that people go into healthcare because they want to help people. This is what a healthcare provider do. They help us when we're sick. They help us stay healthy. They'll help our community stay healthy. But they need to have the government's back. They need to know that if they go out there, they're not going to be on call 24/7, 365 days out of the year. They need to be sure that the small little hospital are not, I called it self-implode. They say that, oh, you don't do 50 deliveries, therefore you cannot do deliveries anymore. You're not competitive doing hip and knees. We can do them cheaper, faster in Southern Ontario than in your little hospital. Therefore, you can't do this anymore. And then you can't keep your anesthetist, and then the hospital self-implode. That makes no sense. Put a rural and northern lens as to how you provide healthcare, and it will happen. You can have a hospital that only does 40 deliveries. Send your people out for training for a week at Women's Hospital. They'll do 50 and then come back and practice in the north. There are models in place, but it was never a priority, neither for the Conservative or the Liberal government, to make sure that we have equitable access for all. And that means that the people I represent are dying 3 years younger than everybody else, and we don't have access.
Well, I just, before we move on, I just want to interject something
Sure.
on that note, and that's that it's been scientifically shown with a lot of especially complex surgeries, and there are certain surgeries that only happen in certain places, that the outcomes are better if these are done on a regular basis. The more they do, the better it is. I can tell you that I had a very complicated surgery called the Whipple, and I wouldn't want to do it in a place that only did one. So,
Well, don't get me wrong. You know, like, they will never be double lung transplant done in Gogama. Everybody knows that. But there should be a basket of service that you identify that is available to all in northern and rural. In some northern places, they are able to keep their service. In other, they are not. Are there some special surgeries that we will continue to have specialty care? Yes, absolutely. Tertiary care is not going to be provided in rural and northern, but primary care should be. And a lot of medicine care is available, and a lot of orthopedic surgery and general surgery can be done safely in a little hospital. Anything that requires tertiary care, we will continue to travel.
okay. Next question. And I think you do have different platforms on this. 10% of older Canadians have admitted to skipping prescription medications because of costs. This mostly affects people between the ages of 55 and 64, and that is when they're starting to experience chronic health conditions, but before they're covered by public programs. Currently, Ontarians 25 and under have access to free medication, and the most recent Liberal budget proposed eliminating the deductibles for everyone 65 and older. So if your party is elected, what would you do, Christine, to ensure that Ontarians have access to the medications they need?
Well, this is a serious concern because we know that sometimes people are taking only half of their medication at a time because they can't afford the rest of it. We shouldn't live in a province where people can't get access to it. So we would support OHIP Plus, but we also know that many seniors need access to medications as well. So we need to, we've got all these great medications coming online now, but some of them are extremely expensive. And I wouldn't want to be the Minister of Health to say, I'd like to provide you with this, but we can't sort of open the gate and provide you with it because we can't afford it. Nobody wants that. So we need to have a plan, first of all, to be able to anticipate that this is going to happen. Again, this is something that the Liberals didn't really anticipate, but we need to work at making sure that we have sufficient money in our Pharmacare budget to make sure that we can afford it. But the problem is that there's only so much that we can promise to people right now because we know that we are in a deep financial hole. We don't have all of the money that we would like to give to every program for every single need. You cannot be all things to all people, and so you have to have priorities. And so I would say to the NDP that you have made a lot of promises to people. You're promising a lot of things in healthcare across the board, but we've seen your budget, and your budget was already $1.4 billion off. And we see that it's a bigger deficit than even the Liberals are calling for. That's a serious concern to me, and I think to many people in Ontario, because we're adding to the enormous debt that we already have. We've got $311 billion worth of debt right now, and we're promising a lot of things that are free across the board to people. Nothing in life is free, we all know that, but what it means is our children and grandchildren are going to be paying for all of the stuff that we have now. And as a mother of three 27-year-olds, that doesn't sit right with me.
So the NDP has a plan so that you don't see people sitting at their kitchen table cutting their pills in two to try to make the bottle last longer. There are over 2.2 million people in Ontario in that age group. I have nothing against people below 25 and above 65, but that leaves 40 years where you don't have any drug plan whatsoever unless you're lucky enough to have it through work. Did you know that Canada and Ontario is the only jurisdictions where we have Medicare, but we don't have Pharmacare? There's 132 other jurisdictions with Medicare. They all have Pharmacare. Ontario is going to bring universal Pharmacare to all Ontarians, no matter your age, no matter where you live, no matter your circumstances. We will start with a list of what we call essential medicine. That is 125 medicine. We have tested it 3 times. It covers about 90% of the people, and that's 2.2 million people that won't be cutting their pills in two anymore.
Okay, you can debate each other, and just to start off the debate, it's been shown that you can actually save money with that basic Pharmacare because of bulk buying. So is there contemplation of a formal Pharmacare program for the PCs?
We don't have that in our platform right now. It's certainly something that we could take a look at when we're in better financial shape, but I don't think that free medications for everybody is necessarily the answer. We already have the Trillium Drug Plan that assists people on low incomes to receive the medications that they need. We could take a look at that and amplify that so that people don't end up having to forego medications or having to cut them in half. I don't want to see that either. Nobody does. But I think that there are modifications we could make to the existing plan that could be less expensive but equally effective for people. And that's what I would want to do, is make sure we get the good value out of every healthcare dollar that we spend. And many people don't need it. They have plans. They have their own independent money. They don't need it. I want to see that money go to the people that need it to make sure that they can get the medications that are going to keep them healthy.
Libby, you are absolutely right that if the government buys the essential medicine for all of Ontarians, so if you purchase for $14 million, you are able to drive the price of those medications down drastically. So we tested a couple of lists. We compared this with, there's about 14 million veterans in Ontario that are on a Pharmacare program. We compare what they pay with what we pay. They pay in general 35% less than what the government of Ontario pays right now. There's room to bring prices down. If we compare with the same list with countries in Western Europe, sometimes it's up to 70% cheaper than what the government of Ontario is presently paying. That will help a lot of people. So you bring the price of drugs down. You make sure that paying for the drugs that the physician and nurse practitioner prescribe to you is not a barrier anymore, and they are savings not only to the government, because we are able to drive down the price and get better deals, but also to the healthcare system, because lots of people, and Christine alluded to that come back to the hospital is because they are not being well treated. They are not following the treatment that they have been recommended for them, because they simply can't afford the drugs that would help them stay healthier. So universal health care is a way. It's better for the people. It's better for our healthcare system. It will be better for the taxpayers. We can't afford to wait.
But I think some of the problems with OHIP Plus, for example, is that there are only certain drugs that are on the formulary that will be paid for that aren't the best drugs, that aren't the latest and greatest. So you end up dealing with the old, outdated medications rather than what's the best practice. So you want to be able to use best practice. You want to be innovative. And there's also some conditions where medication isn't even provided. So it's not universal under this plan. There are some concerns with it that we would want to fix.
Okay. Next question. With the upcoming legalization of cannabis, will your party provide public health education materials to Canadians, and what will the key messages be?
Start with me. To me, it is a shame that we are so close to the date that cannabis will be legalized, and we haven't seen a strong and robust public health programs rolled out. I mean, when they brought a 20% cut on your hydro bill, they spent hundreds of millions of dollars in advertising, telling everybody something that we could have read in our hydro bill for free. But when something as obvious as cannabis is about to be legalized, a whole bunch of people that have never smoked it before will start smoking it, and we hear nothing about this. Shame on them. This is a huge change to public health. It has the opportunity to do great damage to the health of Ontarians. It is the responsibility of the Ministry of Health to warn people about the use of cannabis, and they have done nothing. I'm really, really not happy about this, and I will be happy to continue when my minute comes up.
Okay.
Well, France and I are not going to disagree on this one. I feel exactly the same way. This is something that's been brought forward by the federal government too hastily, I think, without putting the necessary precautions in place, including assistance with law enforcement officers to determine if somebody is driving while under the influence. They have some significant concerns. A public education campaign is absolutely essential for everybody, but I would say particularly for young people who are getting the message that, wow, this is legal, it's all fine, use as much as you want. There are some serious medical concerns out there. I know that a lot of physicians and scientists have concerns about early onset schizophrenia, for example. Not that it causes schizophrenia, but if you have a tendency to it, excessive cannabis use can bring that forward. None of that has been discussed, and it is shocking that something of this magnitude is coming forward with nothing from the Ministry of Health, nothing at all that's of any substance, and we absolutely need that.
Okay. Your debate time is about to start about what you would do. I do have a question, though, and that is about medical cannabis. One of the most heartbreaking calls that I get on Fight Back are people who say, I'm on opioids because I can't afford medical cannabis, which is not as addictive and is much easier on the system. So would you consider putting on the formulary medical cannabis?
Okay, so the body of evidence that shows that cannabis is useful in controlling pain is growing. There is some really good study coming out of British Columbia right now that really shows that this could be useful. The Committee to Evaluate Drugs and the way that they work is completely disconnected from this drug ever making it. It has to be addressed. I'm not a pharmacist, I'm a politician, but I know that the body of evidence is growing, and at some point, the Committee to Evaluate Drugs will have to look at this. I can tell you that I was in a long-term care home last night. A lot of people in long-term care have started to use cannabis oil. It helps them. It helps with arthritis. It helps with all sorts of stuff. But it's so complicated. They have to go in Sudbury, you have to go to a special building, talk to somebody over a camera who will dispense. Then you have to order online. She's 93 years old. She lives in a long-term care home. How do you figure this will work? It doesn't. So her granddaughter does it for her. She has to bring her back every 3 months to talk into this camera and have a urine test. She's 93 years old. Do we really need a urine? Anyway, I has to go through all of that and then order it online and deliver it so that she can rub it on her knee and on her hands and it makes her feel better. Really, like what kind of a system is that? So it needs to be looked at. Sure, we need a robust body of evidence that support all of the anecdotal things that we do. Why didn't the Ministry of Health start investing in this? Why don't we have a study going on right now that shows, is this really worthwhile? Because right now what's coming out of BC is that a whole bunch of people that were addicted or dependent on high-dose opioid are off of them completely, using oil and using non-smokable. I don't advise any smoking whatsoever, but you can consume it in other ways that are not as harmful to your health. And why is it that we haven't got a study here in Ontario? I don't know. But I see it as a failing of our Ministry of Health. It should have been there. It should not be that complicated. It has to be looked at in different eyes than what we have now.
Well, and we all want to see evidence-based decision-making, which we really haven't seen in a whole series of decisions made by the Liberal government, this being one of them. We do have a lot of anecdotal evidence. I've heard of it for pain control, getting people off opioids, for example. I've also heard of it from parents who've used it for children with severe seizure activity. It seems to be working, but we need to know for sure that there is evidence that it works. And if it does, then we need to build a proper program for its distribution. I agree with you, a 93-year-old person should not have to go through 10 steps to get it for pain relief.
Okay. Next question. The majority of healthcare dollars go to frontline and emergency care, and that can come at the expense of care for people living with chronic diseases or seniors and others with multiple medical conditions. So what would you do for them?
Well, there is a serious problem with that. I think that chronic disease prevention and management has become the most significant issue of our time. I think that we're sort of managing with acute care, but there's so many people with so many comorbidities now taking vast quantities of medication. I think that we need to make sure, first of all, that we have a healthy population. So we talk a lot about acute illness and dealing with situations when they come to a crisis, but we never really get to the point of how do we invest in wellness and health promotion, people eating well, people getting the right amount of exercise and so on. And you find that with some problems like diabetes and hypertension and so on, that if people are put on the appropriate regimen, that those issues can, if not go away, but be greatly mitigated. So we need to put a focus on that. I think one thing that we could do is create Chronic Disease Management Ontario, like Cancer Care Ontario. It could be transformed into that.
Okay.
Well, you are right. Our healthcare system was built looking at acute episode, and now most of what we see are people with chronic disease that can be managed if they have access to the right care at the right time. A lot, and I'll take cancer. Cancer used to be a deadly disease. Now it is a manageable chronic disease for more and more people will live through and go on to be happy and healthy. This transitions from an acute episode to managing chronic disease here again, has not been well planned. So a lot of people are not getting the support that they should be getting. And with the consequences of that, oftentimes a chronic disease, you take diabetes, that is poorly managed, will end up with amputation or blindness. All of this could be prevented. And why aren't we doing that?
I'm going to add in a question that I've thought of rather than debating this, because again, you seem to agree. And it's something that Christine alluded to earlier, and that is the level of bureaucracy in the healthcare system. I think there are more healthcare administrators than there are frontline people. We have this whole layer that was added in 2006 or 7, the LHINs. There have even been one group of doctors who advocated abolishing it altogether. We seem to have so much administration. So I am going to throw this out now. What would you do to divert money from administration to frontline care?
Okay, so if we're talking about the LHINs, the Local Health Integration Network, I represent people in Northern Ontario. For me, having decision made at Queen's Park in Toronto often makes no sense once you start to implement them on the ground in Northern Ontario. So the idea that we would have a local body responsible for planning care and delivering it in the way that makes sense to us is something we support. But the way that it has been done, let's just say that the LHINs have been less than stellar in delivering value for money. The Auditor General puts it way more bluntly than I do. We haven't been getting value for money out of this. It has to be looked at. If all the LHINs do is implement the unpopular decision of the Ministry of Health, whenever the Ministry of Health does an investment, it's the Ministry who's making an investment. And whenever there's a cut in healthcare, it's the LHINs that's doing that. That doesn't serve us. That brings no value, and it has to be stopped.
Well, I wouldn't disagree on that, because one of the ideas about when the LHINs were created was that you could minimize further growth in the Ministry of Health, and that hasn't happened. Mm-hmm. And then the CCACs, the Community Care Access Centers, were not disbanded, but merged into the LHINs. The idea, again, would be to put more money into frontline care, but instead what happened was the CCACs just went intact into the LHINs. So we were no further ahead on that, and now what we're doing is creating sub-LHINs, which is adding even more people, where what we need are more nurses in communities, more personal support workers. That's what we actually need. And then within the Ministry of Health itself, there's so many different groups now. They don't even communicate with each other that effectively. And so you end up having decisions being made that aren't comprehensive, because it's one group making this decision without consulting 4 or 5 other groups that have a significant say in it, but they never consult with them.
Okay, so just before we move to the next question, would you get rid of them?
I wouldn't get rid of them, but I would change them significantly so that they can make their own local decisions and not just be a figurehead or something for the Ministry of Health to point their finger at and say it's their fault. Somebody has to be accountable.
I have no problem giving local people a voice. If this is what they're going to do, they are not doing that right now. They are not bringing value for money. They cannot continue the way they are.
Okay, next question. The Ontario Chamber of Commerce has been promoting the idea that our public health care system should be seen as an economic driver rather than simply a cost driver. Ontario is a leader in health sciences, and there is significant opportunity to better incorporate our discoveries and innovations into the healthcare system. So, how would your government do that?
So, right now, we have the committee to evaluate drugs. So when a new drugs come, we have a process in place. It doesn't work that good. It needs to be tweaked, but it exists. When a new technology comes to market, we have nothing within the government to look at it, to say, yes, this is something that would help, here's how much would be a fair price. Nothing of that exists. So every time a new piece of health technology comes forward, a new idea, you have to reinvent the wheel within the Ministry of Health. Let's put in place within the ministry a department who is responsible for looking at new technology and how do we bring them to market so that they benefit the people of Ontario. Oftentimes things that are completely created done completely in Ontario will sell to 14 different jurisdictions before they are allowed to sell in Ontario. This is backward. It needs to change. People need access, and I can name some pretty nifty technology that comes out.
Well, I completely agree with the Chamber of Commerce that health innovation and productivity can be a huge economic driver instead of just a user of tax dollars. We have some amazing research that's being done in Ontario, some great work that's being done in universities, in hospitals, in children's treatment centers. At Holland Bloor Review, for example, they have a great discovery group there. We're coming up with these wonderful discoveries that are brought forward by a lot of young people. Problem is when they get ready to go to market, there isn't the capital available and it ends up going to the United States or the UK or whatever. So we lose the value of all of that education, that research, that talent, and the jobs that could come with it. We could create thousands of jobs in Ontario from healthcare discoveries, even just including the brain research that's happening in Ontario. So what we need to do is to make sure, first of all, that government is set up so you don't have to apply to 20 different ministries. We should have one portal that they go through, and we need to work on fixing that capital gap and work with a health innovation strategist. That is one good thing the Liberals have done. So.
Okay, I think you violently agree again. So we are going to go to the next portion of the debate, and we're going to be taking some questions from the audience. We're allotting a total of 3 minutes for each one, and that includes the question. And we will start with this one, which came in by email from a viewer in Sudbury, and it's about home care and the fact that the needs of home care patients are not currently being met. We know that the visits are too short. Sometimes they are as little as 15 minutes. So we've heard you both talk about home care, but how will you drive more of this funding to the front lines rather than the bureaucracy? Because there are a lot of middlemen involved in home care. So how are you going to get around that?
So thank you to the viewer from Sudbury. So the money leaves the Ministry of Health, it goes to the LHINs, it goes from the LHINs to what used to be the CCAC, that's now the community care. From the community care, they have contract with service providers. The service providers will have subcontract with professional to deliver the care. And at every one of those steps, the money that was supposed to go to the front line gets eaten up in all sorts of bureaucracy that provides no care. The Auditor General puts it at 40 cents on every dollar. We can do better than this. We don't have to have all of those steps before you actually fund home care the way you fund every other program, so that you have minimum amount of money that is being allocated to administration and other means and focus on the frontline care. It makes no sense to have somebody come to your house. If you live in Sudbury, there's a good chance that you drive long distance to get there, go to your house and be there for 15 minutes. Most people as I said, have needs that long. We're already allocated just a few, 2 bats a week is usually what you get in Sudbury. And if you live in Sudbury and have a level of care that is, let's say, 18 on the scale, you will get 2 bats a week. If you live in Ottawa and your level of needs is at 18 on the scale, you will get way more services, the 2 bats a week, somebody to help you with the dishes, somebody change your bed, make a load of laundry. So depending on where you live in the province, let's fix all of this. Let's say that if your level of needs is that, this is the basket of services that will be available to all of you no matter where you live.
Let's let Christine involved, and again, how would you direct more of that money to the front line?
Well, thank you for the question. And home care is unevenly distributed in Ontario, that especially in the north, it almost doesn't exist for a lot of people. In southern Ontario, you may be able to get more benefits. So we need to make sure, first of all, that it's equitably distributed, but we also need to take a look at how it's being distributed and wanting to make sure that we eliminate any unnecessary steps to make sure that the patient gets the care that they need. And I think we also need to take a look at what we're doing as far as payment for personal support workers and nurses and any other health professionals that come to someone's home, how they're going to be fairly compensated, because in many cases with driving, often in very not fair weather conditions, they have to race from place to place. They don't get fairly compensated for it. And then when they do get in to see their patient, they often end up having to shorten their appointments because they're late for their next appointment.
So how much money is your party going to invest in this?
We are going to put the money into it that is necessary to make sure that we get that fair investment for everybody.
What's that number looks like?
Well, I told you we're going to be exhibiting and showing the people of Ontario a completely costed platform that's going to be within our ability to pay before the election.
The election day?
Before the election. We will have that available before the election.
And
it's not going to be a
out.
multi-billion-dollar deficit either, I can tell you that.
Time's running out for both that question and the election. We now have the start of our questions from this audience. Hi, thanks for coming up. What's your name and what's your question?
I'm Beth Kauper-Fung. I am a nurse practitioner, primary health care. I'm also the clinic director at the Georgina Nurse Practitioner-led Clinic and the vice president of the Association of Family Health Teams. So my question is around comprehensive interprofessional teams. Clearly, it's been shown that team-based care is the best model of care for Ontarians, with improved outcomes, excellent satisfaction for both patients and providers, and the better care they get in the community around their diabetes, their dementia, the less often they present to the emergency departments. So my question is, what will your party do to protect, promote, expand timely access to primary healthcare teams such as nurse practitioner-led clinics and family health teams?
Who went first the last time? No, Christine, you go first this time.
Well, first of all, thanks very much for your question, Beth. I am very much in favor of team-based support because that's where you're truly able to care for the patient. Sometimes the nurse practitioner or a physician, whoever initially sees the patient, will recommend that they have perhaps dietary counseling or exercise counseling, or they need to have perhaps some mental health counseling done. So if you're practicing in a team, it's just much easier to coordinate that for the person and to make sure that they can stay well too, because as we try to move from a situation in healthcare where we just deal with acute episodes and we want to keep people hearty and well, then we need to make sure that we approach it on a team base. So we need to take a look at what works in different parts of the province. We've heard that in the north, nurse practitioner-led teams are a very good way to practice. Different care is needed in different parts of the province, so absolutely we would be very interested in expanding those teams. But the problem is, as you know, that new physicians are not allowed to join family health teams right now under the Liberals. We need to take a look at that because they aren't able to provide the kind of care that they want to provide. So we need to open that up to make sure that they can get involved in a team.
Well, pleased to see you, Beth. And our platform is costed. It is there for everybody to see. And you will see that we will invest in 35 new interdisciplinary team, whether it be nurse practitioner-led clinic, community family health team, Aboriginal Health Access Center, or community health center. We do believe that interdisciplinary care is the way to go for primary care. Nurse practitioner-led clinic are at the top of the chart. Whenever you look at the patients' comments, they love you. They love the care. They love that sort of service. Plus, you have a proven record to make a huge contribution toward keeping people, family, and community healthy. So we recognize that, and we recognize that by making an investment to make sure that we can open 35 new ones. There are a number of communities that do not have access to zero at all. So those will be our first priority to make sure that we have a network of interdisciplinary teams teams that works throughout Ontario, no matter where you are, because right now it's a patchwork again. Depending on where you live, you have access, you don't. So we will complete the network. We've identified about 35 sites to be able to do this, to give people access. With our dental care program, there will be a public dental care. A lot of this will be delivered through agencies such as yours, to make public dental care. Anybody over 65 years old who doesn't have a dental plan will have access to public dental services, a lot of those through public health unit or agencies like yours.
Thank you.
Okay. Next question. Hi, thanks for coming up. What's your name?
Doreen Menaker. I would like to know what you or your party would do, if elected, to end the medical surcharges to patients. Both of you have said that you really have a lot that you want to take out of the full hospital system and put into longer-term care facilities. However, I know of someone who's now facing a $1,900 a month surcharge for a complex care facility, plus an additional $1,900 for semi-private. They cannot. They were sent there from the hospital directly to the complex care facility. They cannot breathe on their own, stand on their own, sit on their own, nor do anything really on their own as a result of double pneumonia. So they are being worked on from 3 months of being incapacitated and not being able to work, now facing a $4,000 a month almost surcharge with absolutely no advance notice that this is something they were going to be facing.
Well, first of all, I believe in the principle of universal access, that people should not have to pay for their health care. And this is a pretty egregious example of someone who was placed there for no reason of their own decision making. They should not be facing those charges. They should not be absorbing them. Sometimes things happen to people where they end up in situations where that's the only place that can care for them. They should be able to receive that care there and not be charged. That could put them into bankruptcy. Nobody wants to lose their home or lose their family's assets in order to receive health care. That should not be happening here.
I would say the creeping up of fees in our healthcare system has grown exponentially. So lots of services that used to be in our hospital. Remember Medicare? You can go to the hospital, you can see a physician, it is covered, it is based on needs, not on ability to pay. But the minute that you are outside of the hospital and outside of physician, then you're not covered by Medicare anymore, and there's a lot of fees creeping in. So what is happening to your friend, I take it, is not right. Christine used to be the ombudsman, and I can tell you that I have referred many people like you to her. It should not be happening, but it also happened. You have your colonoscopy done in the hospital, all is free. You have it done in a standalone clinic, and out of a sudden you have to speak with the nutritionist, and the little speak with the nutritionist comes with a $75 bill. Same thing, you have your cataract surgery done in the hospital. It's all free, all good. You have your cataract surgery done in a private clinic, and out of a sudden it's $300 per eye, and you kind of don't want to argue with the physician and say, well, no, it's supposed to be free, so you pay, but then you come and see me and you say, I shouldn't have had to pay. So there's a lot of creeping up of fees that happens throughout. The Liberals have been starving our hospital. Our hospital have decided to keep only what is 24/7 nursing hospital care, and everything else has been sent to the community. I have nothing against the community, but we have to bring the oversight to the community so that this overcharge does not happen, so that there is transparency, there is accountability, there's a way to hold those practitioners accountable so that they respect Medicare and they respect the fact that they're not allowed to charge extra. None of that has happened. The service have left the hospital, gone into the community, and the only supervision is CPSO. That is not enough. The government has a responsibility to make sure that people don't get those extra charge, and if they do, to address that. None of that is happening, and you are not the only person who suddenly gets a $4,000 bill from a hospital or another institution that they never saw coming.
Thank you.
Thank you.
Okay, we have our Last question. The last question from the guy in the Trump hat. What's your name and what's your question?
Well, before I ask my question, I just want to make note of the fact that Kathleen Wynne is bragging on TV about how they built a strong healthcare system, but they don't have anyone here from the Liberal Party to defend that wonderful record. The question I have is, it was touched on, but from personal experience, I can tell you that wait times, I'm not talking about corridor waits, talking about years and years to get a specialist, unless you're dying. I mean, if you're on a death's doorstop, you can get in right away. But if you need certain types of surgery or certain types of chronic care, you can wait anywhere from 1 to 3 years to see a specialist. There's a shortage both of the specialists themselves and the specialty beds, like neurology, for example, where you get sent to Buffalo. I didn't hear anything that would really attack that, but that segues into two solutions. One is more hospitals, and that segues into P3, or alternative financing, and more graduates. What are they going to do about those wait times?
Okay. Christine.
Sure. Well, we did touch a bit on this earlier about wait times, that it's debilitating for people if you have to wait close to a year for a hip or a knee replacement, and for some cancer surgeries. You shouldn't have to wait that length of time. It's debilitating for the person. It's not good for their ability to work as well. So what we really need to do is make sure that the hospitals are equipped both with the specialists and with the operating rooms that are necessary in order to treat them. So they're ready to go. They want to work more, but they don't have the facilities open to them. So we need to make sure that the hospitals receive the necessary operational funding in order to be able to carry out the surgeries and to meet the number of people that need surgery in a particular year, because to wait for years and years is not a good quality health care, and we're not getting the best value for the money that we're spending in health. So we need to look at everything we do and make sure that we're doing it the right way, we're using best practices, and make sure that we have the experts ready and available to provide that.
So you give a good example. So in Ontario, we have this wait time, pay for procedures for certain things. So hip and knees or cataract surgery, those are all monitored and paid for. But when it comes to everything else that is not part of this strategy, what has happened is a lot of resources have gone to those at the expense of people who need neurosurgery, of people who need a back surgery, because those are not part of the wait time, and they get put aside. I was never a big fan of putting some surgery ahead of other. People needs are people needs. Your needs are the most important one, and you shouldn't have to wait more because you happen to have a back injury rather than a knee injury. This is wrong. At the same time, you've been in the room. The Liberal government have been starving our hospital. Hospitals make choices to try to balance their budget because it is the law, and it is good people like you who suffer. We need more hospital beds. You may be surprised to know that we have over 100 ophthalmologists who cannot get hospital privileges. We have over 60 orthopedic surgeons trained here in Ontario who cannot find jobs, who cannot get hospital privileges. We have the knowledge. We have invested into training those very talented and hardworking individuals, and they cannot find work because our hospitals are so starved for cash that they cannot bring them in.
I'm waiting for a nephrologist.
A nephrologist?
I'm waiting.
Yeah.
Thank you very much for that.
Thank you.
Okay, so we're coming to the end of our time. You each have less than a minute. Very quickly, what would you like to leave us with?
Well, the NDP has a platform that is fully costed, that is there for everybody to see, and that says clearly what will be our priority. We will focus on Pharmacare. We will focus on dental care. We will make sure that our hospital gets the money they need so that they can support us. We will focus on home care, and those are there for everybody to see. They have all been costed. The auditor, the financial accountability officer from the federal government has gone through. We had made a mistake. We own up to it. We made the correction. But our promises are there. They are costed. You can read them. You can trust that a NDP government would deliver on the promises that Andrea Horwath and all of us have made through our platform. And I hope you will consider this as opposed to what Christine's about to say.
France, really? Well, healthcare is important to all Ontarians, and it certainly is to us as progressive conservatives. It's one of our 5 major planks in our campaign to end hallway medicine. There are many components that are a part of that, including increased long-term care beds, improving home care, making sure that we put a big addition into mental health and addictions, and making sure that you provide dental care for low-income Ontarians and seniors. That is really important. But you have to choose priorities, and France is right. She has indicated that the NDP are going to provide all kinds of healthcare services, but that's also going to result in a multi-billion-dollar deficit this year, worse than what the Liberals were providing. And the Auditor General of Ontario says that's going to be $11.7 billion. I think with the NDP it goes up to about $20 billion, perhaps even more than that.
No, we're lower than the Liberal.
Well, it's still a multi-billion-dollar deficit, and we can't afford it because our children are going to have to pay for it. We will focus on priorities and bring you better care.
Okay. That is all the time we have for the 2018 healthcare debate. Thank you so much to France Gélinas of the NDP and to Christine Elliott of the Progressive Conservatives and to all our healthcare partners for making this event happen. I hope this has helped you make your decision. Be sure to tune in to Fight Back weekdays at noon on Zoomer Radio for comprehensive election coverage. And please be sure to vote on June the 7th. I'm Libby Znaimer. Goodbye for now.